So now it's my pleasure to introduce to you Terry Lemerond. Terry Lemerond is a retailer, author, educator, and entrepreneur. I find him a very unique force for positive change within the natural medicine world. He has worked in this industry for over 40 years, and he has researched and developed over 400 nutritional and botanical formulas, and a lot of those continue to be top-selling products on the market today. His personal website is dedicated to health and nutrition, and you can visit Terry at terrytalksnutrition.com. And so it is with great pleasure I introduce to you Terry Lemerond. Welcome, Terry.
Well, thank you very much, Cheryl. Thank you for the introduction, and thank you for all the support that you and your staff do for this webinar. First of all, I would like to clarify something. I am not a physician. I am not a doctor of any kind. I hold no medical degrees. So then, what am I doing today? Well, I'm trying to call attention to a very national medical crisis and to spur you to think about what we can do about hypothyroidism. It's a national problem, and no one seems to be addressing it with the proper supplemental attention. And we're going to talk about that today to make sure that we understand what we can do to make a healthier thyroid function. You know, we cannot live without our heart. We cannot live without our liver. We cannot live without our brain. But we can live without our thyroid. Not very well, not have a very quality of life, but nobody seems to care about thyroid function. And in fact, it is a national crisis. In 2015, the #1 drug prescribed in America was Synthroid, which is the synthetic form of thyroxine that supports thyroid function. We're going to learn today that iodine can address all the issues of hypothyroidism and more. Here's the history of iodine. It's a trace mineral. The thyroid cannot function without the trace mineral iodine. It's an essential nutrient. And we don't have a good food supply of iodine. It's found very, very small amounts in food, so very difficult to get from diet alone, especially if you don't eat seafood, eggs, or dairy. But still, that quantity is still extremely small compared to what some doctors think today. For example, I want to see a hand of everyone out there who is taking vitamin D3. Oh, yeah, I can see all your hands raising up. And how much are you taking? 1,000 units, 2,000, 5,000? I take somewhere between 5,000 and 10,000 IUs of vitamin D3 daily. And we could spend an hour or two just talking about the benefits of vitamin D3. And the reason why I brought that up right now is because we should not be taking 5,000 to 10,000 units of vitamin D if we listened to medical authorities, medical experts, and the FDA, who say we should not have more than 400 IUs of vitamin D3. But we found out that there are tremendous benefits from taking vitamin D3, and those levels, even at the Vitamin D Council in Omaha, Nebraska, recommend at least 5,000 units of vitamin D3. That's at least 6,000 units of vitamin D3 for pregnant women. Now, I'm not saying this that you should go out and take 6,000 if you're pregnant. I'm suggesting you talk to your doctor about taking 6,000 units of vitamin D3. Why I bring this up is because we have found the same with iodine. Medical experts, Dr. David Brownstein, Dr. Robert Thompson, Guy Abramson, all have said that the level of iodine is far too low to make a healthy thyroid function. You know, at one point, iodine deficiency was common in the United States, which we call the goiter belt. The Great Lakes area is considered the goiter belt. In the 1940s, 60% of all grade school girls had an enlarged thyroid or a goiter, and it was all because of the lack of iodine. It came to the point when we were in grade school, we used to pass out every week a goiter tablet. We had no idea what they were. We loved them because after we passed them out, whoever had the opportunity to pass them out to the classroom would go in the back room, in the cloakroom, and eat a handful because they were chocolate-flavored pills. We loved them. We called them our goiter pills. They were iodine. They were chocolate-flavored iodine tablets. And without enough of this iodine, we have an enlargement of the thyroid gland, due to the lack of iodine called a goiter. So therefore, at that time, they added iodine to salt to think that would be a sufficient place to increase the level of iodine. But we know now that we don't want more salt, and we don't want to have a lot of refined salt in our diet, and we're cutting back on sodium, so we're not getting iodine from any good source. At one time, iodine was an extremely important medicine used to treat a variety of diseases. In fact, in the early 1900s, Dr. Zen Georgi, who was the discoverer of vitamin C and bioflavonoids, said that they used iodine as the most common medicine because it did everything and everything good. They didn't know why or how, but it worked extremely well, so they used it in many, many cases as an antiviral, antibacterial, antifungal, and anti-cancer supplement. So today, we find that iodine levels are even going down further. In fact, they have dropped 55% since the 1970s. And as iodine intake overall has fallen over 50%. Now, why is that such critical? Well, that as iodine goes down, the causes of thyroid conditions go up, such as thyroid cancer. The incidence has tripled in the last 30 years. And now Synthroid, as I mentioned earlier in the program, is the #1 drug prescribed in 2015. Amazing. Over 20 million prescriptions in 2015 for Synthroid. It's the #1 prescription for a condition that is only conditioned because of a lack of iodine. We need more iodine in our diet. We need more iodine maybe as a supplement, but it is critical for thyroid function. But why? Well, today we have more what we call disruptors of iodine absorption. Sources of exposure to fire retardants, to medications, to swimming pools, to plastics, to pesticides like fluoridated toothpaste, fluoride and chlorine in drinking water. Most drinking water in America, city drinking water, tap water, has been fluoridated and chloridated. So all these are disrupting the absorption of iodine into the thyroid. The bromides, brominated vegetable oil. There's bromines in all kinds of different sorts. In pools as a disinfectant, in certain drinks and beverages. We find it in drugs and medications. So we are getting more fluorides, more chlorine, more sodium fluoride, more brominated vegetable oils, which disrupts the absorption of iodine into the thyroid. So now we have iodine in the thyroid. So here's what happens. The thyroid hormone production requires iodine. That's the bottom line. And we are not getting iodine. It's not in the soil anymore. We don't have enough food with iodine as a source. And we do need it for the conversion of the combination of iodine and L-tyrosine into thyroxine. So first of all, the pituitary gland releases the thyroid-stimulating hormone, the TSH, to the thyroid gland. The thyroid gland, along with iodine and L-tyrosine, produce both T4 and T3. Without iodine, it only produces T4 from the synthetic Synthroid, and we never get to an active form of T3 in at least 30 to 40% of the population that uses Synthroid. And did you know that constipation, interesting fact, can be a sign of low thyroid function? Not only is the thyroid involved with the iodine production, but also to the intestinal tract. Why? Because about 20% of the conversion of inactive T4 thyroid hormone to its active form of T3 occurs in the intestines due to the activity of beneficial bacteria, the probiotics. Decreased levels of the probiotics, the lactobacillus and the bifidobacterium, have been associated with abnormal thyroid hormone levels. Thyroid hormones aid in the proper contraction of the intestines, the peristaltic movement. To move food through the intestinal tract, without thyroid hormones, the muscles get weak and the food takes longer to get through and results in constipation. So here are some of the signs of low thyroid function. In fact, after the program, if you want to go to my website, terrytalksnutrition.com, and you go to the e-newsletter archive section, and you can type in hypothyroidism, you can type in iodine, You can type in low thyroid or just thyroid function. And you'll get a number of newsletters that I have written that talk about how iodine relates to low thyroid function. And there's a test in there that you can take to actually indicate whether or not you are suffering from low thyroid function. So here are some of the signs and symptoms that are associated with an underactive low thyroid function. Aching muscles, always fatigued or exhausted, irritable or impatient, cold hands and feet. Some people just sit around in a room where everybody is comfortable. They're all sitting in short sleeves, and maybe you or someone else is sitting there with a shawl on or with a blanket wrapped around them or with a sweater on or a sweatshirt. They're always cold. They have cold hands, cold feet. Some of you spouses know that your partner may have cold feet, because in bed sometimes, your feet are like ice. The thyroid is the gland in our body that sets the metabolism. The thyroid is like the thermostat in our homes. If we're cold, we turn it up. If we're hot, we turn it down. And that's exactly what the thyroid does for us. It sets the temperature. It sets the rate of metabolism. It sets the rate of burning calories. It really sets our whole metabolic function of our body. And we often are depressed. We have dry, coarse, lifeless hair, loss of hair. This is very common for women. They lose their hair. They see more hair on the pillow, in the sink, or in the shower. They tend to have dry skin. They have lost their desire for sex. They have no libido. They don't eat anymore, but they gain weight. It's a common thing. They just say, I'm dieting, I'm trying to lose weight. I eat less food, but I still gain weight. That's because we don't have the rate of metabolism in our body that is set by the thyroid and set by the iodine. They sleep long hours without feeling rested. They are slow thinking and have poor focus. They lose the enthusiasm for life. And they have the thinning of the outer third of the eyebrows. Very, very common in women that have lost the outer third of the eyebrows. In fact, I've run into some women in my lectures that have lost their eyebrows and their eyelashes. All the hair falls out and have lost a lot of hair. Women should not lose their hair. Men can't say that. They have the genetic baldness that occurs in many men throughout their life. But women should never lose their hair unless they have a hormone deficiency or a thyroid deficiency, and then they can lose large quantities of hair. And it takes some time for that to reverse, but it's very possible to do so. Treat low thyroid function. Here's what the bottom line is. You can't have a healthy thyroid without iodine. And along with that is the amino acid L-tyrosine. So you have two natural components. One a mineral, iodine, one an amino acid, which is found in protein foods, which is called L-tyrosine. These two combine in the body to produce thyroxine, the thyroid hormone. These nutrients are the building blocks for thyroid hormones, and without them, there's absolutely no way the thyroid gland can produce the thyroid hormones. So number one, doctors have a phobia about iodine. The only iodine doctors really have an acquaintance to is radioactive iodine. And radioactive iodine is used commonly by physicians to destroy the thyroid. I've talked to many women across the country during my lectures, and they have said they have gone to their doctor. The doctor recognizes the fact that the patient has cysts and nodules on the thyroid, all the result of a deficiency of iodine. The doctors do not recognize iodine as a mineral to support thyroid function. So they are concerned about their patients. They know their patients could have a higher risk because of those cysts and nodules for thyroid cancer. I understand that. And doctors are, you have to commend them for at least considering the fact that it does increase the risk of cancer of that patient. But then they prescribe radioactive iodine to protect the woman, and all that does is to destroy the thyroid. Now, you can only destroy the thyroid with radioactive iodine in the absence of iodine. When we have a crisis like we have done in Japan, where we have the nuclear reactors breaking down and we have radioactive iodine spewing across the country, spewing across the oceans, and what have people said? Even the FDA said, increase your iodine levels to prevent the radioactive iodine from destroying your thyroid. So if we protect our thyroid from radioactive iodine with iodine, the only way the doctor can destroy a patient's thyroid is in the absence of iodine. So the doctor is readily admitting, not knowingly, but the patient is very severely deficient in iodine. Iodine is just not a thyroid medication. When you think about bones, what do you think about? Calcium. When you think about your heart, what do you think about? Magnesium. When you think about your thyroid, no, it's not Synthroid. It's iodine. And every cell in the body has a receptor site for iodine. Iodine deficiency can be linked to cancer, obesity, heart disease, fibromyalgia, ADHD, and most other mental problems like Alzheimer's disease, depression, Parkinson's, ALS, and MS, multiple sclerosis. So also, iodine and breast disease, commonly occurring in women across the country. Thyroid, iodine, and breast disease connection. There's a strong connection. Now this is not Terry talking about this. This has also been all scientifically referenced, and I am just the messenger. I'm just carrying this to you because I want to see you at least think about adding more iodine to your diet. We can't get it from our food, so there is a number of sources that we can use as supplemental sources. So there's a strong connection between thyroid disorders and breast disease. These are statistics that are known in scientific sites, but I know many of you people just don't have time. Well, our research staff has time, or at least they take the time to make sure that we bring you a lot of good information to make sure that you have the news readily available. So having thyroid cancer increases the risk of breast cancer by as much as 40%. And low levels of iodine increase the risk of developing fibrocystic breast disease. And women who have breast cancer have lower tissue levels of iodine than women who don't. And here's a really good fact. Japanese women consuming high seaweed diets, which are rich in iodine, have very low levels of breast cancer. But when those Japanese women move to the western parts of the world and can start consuming Western diets, they have the same cancer rate as the rest of the population in the Western world. Here's something else you might want to just take in consideration. As we have learned that Japanese women, and all Japanese, are taking more iodine in their diet because of the increased levels of seaweed, we have looked at some of the kelp and other seaweed foods that are sold in America. We are finding out that they are highly contaminated with heavy metals. So you have to be careful. There are not many good sources in the world for kelp that is not contaminated with lead and other heavy metals. So how does it work? Well, iodine makes breast cancer cells sensitive to estrogen, less sensitive to estrogen. So we want to reduce estrogen levels. 70% of breast cancer cells have receptors for estrogen. So that's why doctors put patients on tamoxifen to restrict the conversion of estrogen, or restrict the androgens to converting to estrogens. Estrogen receptor positive breast cancer cells grow proliferately when exposed to estrogen. So iodine detoxifies the bromides, the fluorides, the chlorine. So iodine is a very excellent mineral to prevent the uptake of these toxic halogens. There are 4 halogens: bromides, chlorine, fluorides, and iodine. They are found on all the same level of the table of elements. So they are in the same level. They have the same uptake. So when you do not have iodine, you take up more of the bromides, more of the chlorides, and more of the chlorine. But when you have plenty of iodine in your system, you block the uptake of those. And those are all cancer-causing chemicals. Bromides, sodium fluoride in drinking water, chlorine are all cancer-causing chemicals. One study found that breast cancer patients had double the bromide levels compared to non-cancer patients. Research on breast diseases. In clinical trials of women with fibrocystic breast disease, approximately 70% of patients experience relief of pain and reduction in abnormal tissue with iodine supplementation. You know, when women have nodules and cysts of the breast, or nodules or cysts of the thyroid, it's all iodine related. The more iodine the woman takes in, the less risk she'll have of having nodules and cysts of breast and also of thyroid. In patients with breast pain, at least 50% of women had significant reduction in breast pain after taking 6 milligrams of iodine daily. In an animal model of breast cancer, iodine supplementation reduced breast cancer incidence by 58% versus untreated animals. That's a huge advantage to lowering the risk of breast cancer by 58%. I don't think there's a drug available that has the ability to do that. And infertility, iodine and fertility reproduction. Low thyroid produces low metabolic function, which always causes cold hands and cold feet. So the temperature of the body is also going to determine fertility of the woman. Researchers tested almost 400 women struggling with infertility. 24% of the women had low thyroid levels of the hormone. When given supplemental hormone treatment, 77% conceived within 6 weeks to a year. In a study of almost 5,000 women, pregnancy failure, miscarriage, or stillbirth was twice as likely in women with iodine deficiency versus women who had sufficient iodine levels. In a separate study, prenatal iodine supplementation reduced pregnancy failure by 10%. And in another study, prenatal iodine cut the rate of stillbirths in half. It's the body heat. When women have a normal body heat, which is necessary for ovulation, and one cause of irregular cycles can be insufficient metabolic activity to trigger ovulation. No ovulation, no menstrual cycle. And to predict ovulation, many women take their temperature before arising in the morning. An increase in temperature signals that ovulation is about to occur. Iodine can help increase the basic metabolic rate enough to more consistently assure regular ovulation. Many women who could not conceive are iodine deficient. Iodine is especially important during pregnancy. Iodine is essential for baby's brain development. Only 20% of pregnant women and 15% of breastfeeding women get the minimally recommended levels of 150 micrograms daily. Remember, vitamin D3 was 400 IUs daily. That was the recommended level. And now we're taking 5,000 to 10,000 units of vitamin D3 daily. We don't know how much vitamins and minerals today we need, as no one is doing the research on vitamins and minerals today because nobody cares. And anybody who has the wealth of finances, like drug companies, do they care? Do they care about nutrition? And nobody teaches nutrition in med school. So no one is getting their proper levels of vitamins and minerals today. And then the fact that we are getting more chemicals, more toxic elements in our life today than we ever have, and more radioactive iodine across the world. We are constantly in need to increase our vitamins and minerals today, not lower them. And more than 35% of pregnant women are now at least modestly deficient in iodine, up from just 4% in the 1970s. Iodine deficiency is the leading preventable cause of mental retardation. So what a shame that women are not getting enough iodine, and this is proven by supplements that are available here. For example, here is a vitamin supplement, a prenatal. This is what people put on the market as junk. I think, to me, it's just criminal that people will sell something like this. And I know women are trying to make a decision as to what to take when they're pregnant. And they are confused as to what they should buy. And you have to admit it, most people don't take the time to understand the labels. and what they mean in terms of what we should be taking and what we should not be taking. Only 50% of prescription and non-prescription prenatal vitamins contain iodine. Crazy. This is a prenatal gummy vitamin with no iodine, no minerals, but sugar. Junk. They have a little bit of 25% of the zinc level. But they classify it as a prenatal product. Doctors and medical drug companies just don't care about the nutrition that women should be getting during their prenatal time. Iodine for postmenopausal women. With aging, the thyroid becomes less efficient in taking up iodine. It is estimated that about 24% of postmenopausal women have subclinical thyroid disease. Subclinical rather, is a disease challenged and present, but symptoms may not be, maybe only mild and undiagnosed, but they don't feel good. They have underactive thyroid, but not enough to classify themselves as being sick or having a disease, and it goes on for a long period of time. And even with blood chemistry, it's not easy to tell if there's an underactive thyroid. A clinical study involving over 200 postmenopausal women found that low iodine levels were associated with increased risk of hot flashes. It's common that if women take enough iodine, they probably would not have the complications which occur during the postmenopausal period. And even the brain suffers. The entire body suffers from a lack of iodine. Attention deficit. In a 10-year study, researchers diagnosed ADHD in 69% of children born to mothers living in an iodine-deficient area, while no children born to mothers in an iodine-sufficient area had ADHD. You know, most of the challenges we have today, all the conditions that doctors are treating today with drugs and medications are occurring because we don't have enough vitamins and minerals and nutrients that we should be getting from a good, healthy, nutritious diet. 98% of all our diseases is caused by a deficient diet. In a study of approximately 200 children with mild to severe iodine deficiency, supplemental iodine for 1 year was associated with improved mental performance, especially in reasoning ability. In 10 to 12-year-old children with an iodine deficiency, supplemental iodine for 6 months significantly improved the results in 4 out of 7 of mental functions. It takes time. And even with the thyroid, if you're going to be using iodine for thyroid function and you're looking at the symptoms and the signs and some of them are not going away like you would like them to go away, takes time. Be patient. Dr. Broda Barnes, who was one of the world's experts, spent 60 years studying thyroid. He was the one that was responsible for developing Armour thyroid. He knew more about thyroid than any other man in the world, and he said it would take 6 months to a year to restore a normal thyroid function. So don't panic if you take iodine for a week or two and you're not seeing some really good signs occurring. It takes time for everything to be reestablished and to be restored back to a normal condition. So supplemental iodine, very important to take. Multiple forms of iodine for best results. So different body tissues have subtle preferences for certain forms of iodine. For example, thyroid tissue, the thyroid gland. The iodine that we need to combine with L-tyrosine should be potassium or sodium iodide. That means that iodine is combined with potassium or sodium. So it's bound to another element. For the breast tissue, we want molecular iodine. That is a different form of iodine that the breast tissue almost like sucks up. It really enters the cellular tissue very quickly. Sodium iodide is the most soluble form of iodine and increases the absorption of other forms as well. So what is a therapeutic dose of iodine? Well, many of the doctors that I mentioned prior in the part of the program, Dr. David Brownstein, Dr. Robert Thompson, Dr. Jacob Teitelbaum, Dr. Guy Abramson, they all are looking at milligram forms, anywhere from 6 milligrams on up to 25 milligrams. For the thyroid dysfunction, if the thyroid is underactive, it might take 30 milligrams of iodine with the 3 forms, because we're talking about thyroid function, and 400 milligrams of L-tyrosine. For other health concerns, 3 forms of iodine, potassium iodide, sodium iodide, and molecular iodine, low dose, 3 milligrams daily would be really a good maintenance dosage. For mild range, for most people, 6.2 to 12.5 milligrams daily. Dr. Gabe Everson, in fact, you can Google the Iodine Project. That's the name of the project, Iodine Project, and you'll find a number of studies that were done earlier that shows that the average daily dosage of most women who are healthy and have a healthy thyroid is 12.5 milligrams daily. Now, many doctors are using a loading dose, meaning they're using 25 to 50 milligrams, not for a long period of time, for occasional period, up to maybe 2 or 3 months to saturate the body, to saturate every cell in the body. It's an arbitrary time to say, well, that should be enough time to at least load up all the cells and the receptor sites in the cells to make sure that there is sufficient iodine levels in the body, and then to maintain those levels with 6.2 to 12.5 milligrams daily thereafter. Now, really, for more thyroid and adrenal function, you can watch my webinar, Overcoming Thyroid and Adrenal Dysfunction, on the Terry Talks Nutrition YouTube channel. We have many people that have gone there to watch it, to view it, and listen to it, and they're getting some phenomenal results. Now, here's something that has really shocked, I think, myself and many others. We have found that rhodiola and ashwagandha really help support thyroid function. In fact, some people are reporting back they're getting excellent results after a period of time taking a combination of rhodiola and ashwagandha. Adaptogenic herbs also increase thyroid health, energy, mood, brain function. In a human study, rhodiola was found to improve mood and energy in patients with low thyroid function. In a study of patients with subclinical thyroid function, ashwagandha improved the TSH, the T3, and T4 significantly compared to placebo. So adding these herbs along with iodine to a thyroid protocol is extremely beneficial. You'll feel better overall. So we're to the point of questions, so I'll turn this over to Cheryl, and maybe we can take some questions.
Thank you so much, Terry. We already have a lot of questions in the queue, so let's get started. Here's a person who said they had a procedure that they called irradiated thyroid. They do blood checking, and this person would like to know what they can do to support their thyroid now. The doctors she's working with are very passive about this, and she hasn't felt right since this procedure.
Well, I'm not sure. Is she taking medication? I mean, I wonder if this lady is on Synthroid.
I do not know. And also, right, probably.
If they radiate it, I'm sure she's on thyroxine or some form of synthetic hormone. I would tell her to go back and talk to her doctor. That I would explain to the doctor, I'm not happy. I'm not seeing things right. I would suggest 6.2 to 12.5 milligrams of iodine. Take it along with your thyroxine and talk to your doctor about using the combination, and ask your doctor to monitor the results and while she's using the combination.
Excellent. All right. Here's another person who wants to know the upper limit of iodine by blood work. She was told to take 50 milligrams of iodine a day because she was deficient. And now she's been taking that for 2 years, and she's also added some iodine nutrients that are necessary for iodine activity in the body, like cofactors for iodine. And now her blood work last month was over 1,000. So do you have any idea of upper limits?
Well, according to some of the doctors, Dr. David Brownstein and Dr. Gabe Emerson, they said that there is no maximum. I don't say you should take high levels because I'm not a doctor, and I don't think you want to do that without a doctor's monitoring your blood work. But they said that it is the safest mineral of all minerals. They were recommending in the 1900s up to 1,000 milligrams a day. It really has very, very, very safe tolerance. I don't know. I've never heard of anybody taking 50 milligrams for 2 years. I do say that in the last seminar that I went to that was done by Dr. David Brownstein, he himself takes 150 milligrams of iodine daily, and he has said repeatedly that the sicker you are, the more iodine you require and you need. It's very, very safe, but I would like to always have somebody take those kind of dosages under the supervision of a physician.
Excellent. Let's see. Let's move on to, can iodine cause a lower threshold for stress? Do you get more stressed out when you take iodine? I think that's what this person is asking.
No, I've never seen that in my life. In fact, do you feel better? You feel less stress? And absolutely, if you take iodine, and I would recommend 12.5 milligrams as a daily dosage, and maybe 25 for a few months, then drop back to 12.5 milligrams. Stay on that for a daily intake. It's a good maintenance dosage. Add the rhodiola and the ashwagandha, and I think you're going to see some really, really good benefits over the next 3 to 6, maybe 12 months. It depends on the individual. How much bromides are you getting in your diet? How much chlorine or fluoride? You know, these are all disruptors. And if you're getting those and you're trying to get healthy, you know, it's like trying to burn the candle at both ends. Who's going to win? Pouring gasoline on a fire at one end and trying to put water on the fire on the other end, it just doesn't work. So the bromides, the chlorine, the fluoride, the chlorine, they're all the gas. They're all being poured on the fire. So it ties our hands to see which ones are going to get the best results. And also, too, I found really, really good benefits when women go off soy and when they go off all gluten foods. It makes a huge difference in thyroid function.
Great. We also had, I think some people had some audio trouble they didn't hear. They said that, did you say that Dr. Brownstein said to take 50 milligrams for 10 years? No. Dr. Brownstein said in his book, 50 milligrams for 2 or 3 months is a loading dose, and then for most individuals, didn't he say 12.5 milligrams? I think they misheard you, Terry.
Correct,
right.
That's correct. 12.5 milligrams thereafter. In fact, I would recommend, Dr. David Brownstein has an excellent book to read. One of the books is called Iodine, Why You Need It and Why You Can't Live Without It. The other one is Overcoming Thyroid Disorders. He's got 2 great books out that should be read. He's got a website. You can go to it and just Google David Brownstein. You can also go to Dr. Robert Thompson. His book is What Doctors Have Not Told You About Iodine and Your Thyroid. If you're interested, you need to read these books to really educate yourself, because doctors will not help you understand why you have a thyroid disorder. They're just going to recommend and prescribe Synthroid and wipe their hands of the whole situation.
Here's another person who misheard. They couldn't tell if you were saying B as in boy or D as in dog for B3 or D3. I believe you were saying D3, 5,000 units of vitamin D3, correct, Terry?
D like in dog.
Right. All right. I think
that must be my Belgian accent. I think that's my Belgian accent.
Do you think so? Perhaps.
Yeah, I think so.
I think we had a few people that said they had kind of a fuzzy connection. Here's a person who says, what about the claims that iodine is contraindicated for Hashimoto's thyroiditis?
Not according to Dr. David Brownstein. If you read his book, he's going to tell you that it's an all-inflammatory process that causes the autoimmune disease, and the autoimmune disease is caused by a lack of iodine.
All right. Here's another question from a person who says they don't have any problems at all. They're healthy, but they wonder how much iodine they should take just to stay healthy, ongoing.
I would say somewhere between 6.2 and 12.5 milligrams daily.
All right, make sure that we haven't missed anything. What's a good dosage? Here's one. What's a good dosage for children with ADHD?
I would say about 0.5 milligram, 500 micrograms. There's a good way to take that, just maybe by tablet form. Maybe there's a chewable form available. But for kids, I would just say about 0.5 milligram.
And then maybe when they start to get in their teen years, they can move up to adult dosages?
Yes.
Right. Is there a connection to iodine helping with eczema?
I have not seen anything that I can say that there's a study out there or there's some science that supports that. Eczema is an inflammatory process. Curcumin, boswellia, they may be valuable because they're anti-inflammatory. There's also some allergies involved. It could be dairy, it could be wheat. There's something that's going on in the body chemistry other than just the lack of it. So I would say look for an allergy, look for an anti-inflammatory ability to get rid of the eczema or the eczema. I would do it that way instead.
All right. Here's a question about, they know that some iodine is sold in a liquid form. Is that a good way to take iodine? Is that okay?
It's okay. Yeah, it's okay. It's more inconvenient. It doesn't taste good. I don't think there's any more benefit. I think it's easier when you take it in a dry form in a tablet.
All right. I just want to make sure I haven't missed any. We keep getting so many popping up just when I think we're done. We got more questions coming in. Here we go. Oh, if you're allergic to seafood, can you still use iodine?
That's a good question. You have to be very careful with it. The only thing I've ever seen, and I stand by this, most people who are allergic, they think it's the iodine, but actually it's the food substance. I have a lot of people that have told me I'm allergic to iodine because every time I eat fish, I break out. We're not allergic to minerals. We're not allergic to calcium. We're not allergic to any kind of mineral or vitamin. We're not allergic to iodine. It's the protein that causes allergic reactions, like pollen, like animal dander. Those are proteins. When we eat eggs, it's the protein of the egg that causes the allergy reaction. There is no protein involved with iodine. It's the protein of the fish or the seafood that causes the allergic reaction.
I'm trying to, but I can't because it won't let me do. Sorry, Terry. Go ahead.
That's all right. That's all right. That's all right. Go ahead.
All right. Folks, I am trying to list that. We had some questions about the name of the books, so we'll repeat them again. Iodine, Why You Need It and Why You Can't Live Without It by Dr. David Brownstein. And also, I believe it's Robert Thompson, isn't it? Dr. Robert Thompson. Right.
Right.
Iodine, everything your doctor doesn't.
What your doctors don't want you to know about your thyroid and iodine.